Thank you again for being here for our next city briefing and update. We are at April the 22nd. It is Earth Day, actually the 50th anniversary of Earth Day today. And we are doing our briefing this Wednesday. And of course, I want to begin by thanking Alice from the Health Department, who will be doing our update in Spanish in just a few minutes. So en español vamos a tener un resumen en español después de esto. And then, of course, Paola, who's right behind us, who's doing our ASL translation. And we're joined, as usual, with Dr. Davis from the Health Department, who will be giving us more updates about what's going on with our health orders and the city as well. So we'll have several updates today, but I want to start with probably the one issue that we're getting the most questions on, and the one where we have a lot of great information to share as well, and that is as it relates to testing. Let me begin by giving you some overall data and some overall numbers. And some of these numbers are approximate, and I'll explain why in just a minute. Let me start with going over our numbers. We believe in Long Beach that through both our partners within the health world, so our private health partners and our drive-through testing centers, that we as a unit have done a significant amount of tests. So we estimate that we've completed in Long Beach about 4,700 tests for COVID-19. And of those 4,700 tests, about 2,300 of those have been through our 4 drive-through testing centers, most of which of those were open just this week. And another 2,500 of those have been through private labs and our health partners across the city of Long Beach. So how did we break those down? I want to begin by mentioning that of those, we think that through our main health department lab, and that's been our main drive-through center in Long Beach, we've done about 430 tests. Our Long Beach City College Pacific Coast campus site, we've done about 1,100 tests, 1,170 tests. Through our Jordan High School site, we've done almost 400 tests, and this is as of today. And our Cabrillo High School site, we've done about 180 tests. And so those numbers, when you combine those and you look at what we're doing with the amount of tests that have been done through our private labs, we approximate about 4,700. The reason why it's an approximate number is we don't always get an exact count from all of the private labs. Of course, we have direct counts in our 4 drive-through centers, but it's a little bit more broad. And so we are doing a lot of tests. We have tripled our testing capacity in just this last week. And as you can see, we are getting a lot more of these tests at our drive-through centers. We want to encourage folks that if you have a symptom, to get tested. So if you have a symptom, you're feeling like you are sick or have these flu-like type symptoms, these COVID symptoms, please go get tested either at Long Beach City College on Pacific Coast Highway, at Jordan High School, or at Cabrillo. And of course, we also have now our St. Mary testing center as well. And we're getting those numbers coming in. And when we include those numbers that we're going to be getting in the next few days, we certainly are over the 5,000 tests. And we're going to have a clearer picture of those numbers towards the end of the week when we have a full week of data. And so that gives you an approximation of where testing is going. I mention all of this because we want folks to get screened and get tested. They can go to the longbeach.gov website, click the testing page, and then you can pick which testing site you want to go to and go right through the testing process and get screened right there and make your appointment. There are appointments available. So my message to everyone is if you feel like you need a test and have symptoms, go right now today and get a test, make an appointment for the next day or so at one of our sites. That gives you the broader testing picture of where we are. And of course, I want to share some of our general numbers for today. We are up to 489 residents who have been tested positive for COVID-19. I also want to report, sadly, that our total deaths are about 27. We know that these numbers are always changing, and our thoughts and, of course, are always with the families, and our prayers are with the families, and, of course, the friends of those that we have lost. So far of the 27, all have had other underlying health conditions, and they have been, of course, through their 50s all the way through their 80s. That has been the age range of these individuals. We continue to lose folks, but we also continue to see positive recoveries, and so that is also the positive thing. I'm not sure, I think we want to say that we're almost at 300 recoveries of individuals that have recovered from COVID-19. That is a good sign. That number also changes, but it's something that we're continuing to monitor and are very, very grateful for. And so again, we expect, as this testing is ramped up, that our positive COVID number is going to actually continue to increase. And we think we may even see a spike over the course of this next few days or week, because there is just way more testing happening this week than there was last week or the week before. And so we're going to keep an eye out for that, and we're going to let folks know how that is going. Our hospitals, just so you know, are working really hard. None have reached a point where they are overburdened with capacity or full. We've created all that extra room and all those extra beds in preparation, and they are doing really, really well. That's not to say it's not a difficult environment, that our nurses and doctors still don't need our help with these stay-at-home orders, but we are, as a community, we're managing, thanks to you, thanks to all of you, being responsible, being at home, listening to the advice of our medical team. We are able to flatten this curve and are really providing a level of relief that our hospitals need right now, because they are seeing COVID patients on top of all the other patients they have in those hospitals. And so thank you from all of them, and let's keep that work going. And so we'll have more information on that as that continues, but so far we are doing okay, and we got to stay there. I want to bridge that to a conversation that the governor had earlier today. The governor announced earlier a huge ramp up in testing statewide, and so you probably are reading that he is announcing additional testing sites all up and down the state of California, and expects to ramp up testing dramatically within this next week. We are working with the governor on that initiative as well, and so we are hopeful that we will have additional drive-through testing capacity moving forward. That's all being worked out right now through the governor and our partners at LA County, but that's something we hope to have more information about in the near future. So even more testing capacity is on its way. I want to add on a couple other items that are important. One question that we always get is the street sweeping question. As people probably know, the city has not been ticketing for street sweeping, and we've been doing that over the course of this last month. We believe that folks that are struggling should not have that additional burden of having to move their car, especially in parking impacted areas. We also know that street sweeping is really important to keeping the city clean for water quality and to clean storm drains. And so please know that while this is a temporary measure, that we have to get back to fully street sweeping the city. So what are we doing? What's the plan moving forward? As you've probably been aware, the city paused giving out citations on street sweeping. We did that because we wanted to give people that relief, particularly those that are struggling. That citation relief was set to end at the end of this month. So that was going all the way through until the beginning of May. Last night, the City Council extended that citation relief by an additional few weeks. And so now the date of the resuming of that citation enforcement process won't be until May the 18th, which aligns with our current end of our stay-at-home order. And so that doesn't mean, by the way, that the stay-at-home order is going to end on the 18th. There could be changes. There could be an extension. We could see some changes that relates to the economy around that time. We just don't know yet. But that's the alignment that we've now done. And so what can you expect to see? The first thing you can expect is that beginning May the 4th or early May, our street sweepers are going to come out in full force across the city. We have been doing already street sweeping across the city. That hasn't stopped, but it's been difficult to do because a lot of cars aren't being moved, which we understand. Beginning May 4th, we will street sweep the entire city. We're asking folks to move their cars and to please move their cars. We've also provided over 5,000 free parking spaces across the city for people to park their cars temporarily. And again, at the longbeach.gov website, you can apply for a free parking permit and one of these parking lots to move your car, and you can keep your car there if you like as well. So beginning May 4th, you're going to see the street sweepers out, and they're going to try as much as they can. If there's a car that has not moved, we're not going to give you a citation, which was the current plan, as we probably know, towards the end of the month. We're going to leave a warning on your car and just ask folks to please understand that in a few weeks after that, we have to go back to enforcement, because if we don't enforce, we won't be able to sweep the whole city. We're going to have massive trash collected, public health and safety issues, and storm drain issues. We are required also from a water quality perspective to keep the water system free of debris, and this is causing us some issues which could cause us serious infrastructure issues as it relates to water quality. And so May 4th, street sweepers come out, and then for the 2 weeks after that, we will start giving people basically messages to let them know that street sweeping will resume with enforcement come May 18th, but also options for folks, giving them lists of where the free parking is, showing them how we can help them move their car. And so just know, everyone, that we want to work with you. We have been very lenient because we think that it's the right thing to do, and we're going to continue to assess and be flexible. We don't want to put any burden on you guys, but we also know that we've got to clean our streets. So we're trying to find a right balance, and we'll have more information on that in the weeks ahead. If you want a free permit, please go to longbeach.gov/parking. It's longbeach.gov/parking, and you can get your free parking permit. And again, we have already, I think, about 1,300 of you have applied for a parking permit, which we're providing for free. We have an additional over 4,000 spaces ready to be used by the community that we've set aside. So please use those if you can. And as a reminder, you can still receive a citation if you park in the red in front of a fire, a zone, or if you park in the blue. And why is that? Is that red and these blue zones are emergency turn lanes. They're there so that a fire engine can turn at the appropriate radius, and they're there in case there's a fire, we can plug in and get water and save lives and property. And so those areas have to stay clear, and you cannot park in those areas because of the life and safety issues, and because we have a lot of folks calling in and having needs around COVID-19 also from our paramedics. We need to keep those clean. So please, red curbs, blue curbs, white curbs, now those continue to have enforcement, and just remember that, please. I want to now just transition to a couple other topics. We have, of course, we have an amazing library system in Long Beach. I want to remind folks, especially that while you're at home, that we have a library at home program here in the city. If you go to our library website from longbeach.gov, you can access thousands and thousands of free books, and audiobooks, podcasts, all sorts of different things that will allow folks to get resources and books into their home. We know that people want access to these programs. They are all available at our libraries. You can also, there's practice programs there for taking SATs, for citizenship, to help people navigate legal questions. There's all dozens of programs that are available through our library system. And all you have to do is sign up for an online library card to access all of these programs through our library system. So I encourage you to use our library at home program that's available now for the community. I also want to note that We announced yesterday our Economic Recovery Advisory Group. We listed the members yesterday. We put together a great group of business leaders, community leaders, innovative thinkers to really share with the community and with the city and us what is the best way to reopen the economy in a way that is safe to the public. Now, we know that when the question of when the economy opens is one that's going to be left to science and data and our medical professionals. But how we do so, and the safest way to do so, is a question that we need to be asking the folks that are in our businesses on the ground, our small business owners, and our great thinkers here in the city and across the state. So we are going to be getting and collecting the best ideas so that when we begin loosening up these restrictions in these weeks ahead as we have this conversation, we're going to have the best plans in place, because we know that people are out of work, we want the economy to restart, and we want to do it in a safe way. And we are not going to be pressured into reopening things before it's safe. We're going to do those in a way that is appropriate. And so I want to thank Mayor Bob Foster, who's leading that group, and the 20 members that are all a part of that group that are going to be providing their recommendations over the course of these next few weeks. And I want to thank them. And the last thing I'll just add before I turn this over to Dr. Davis is, again, we are celebrating 50 years of Earth Day. It's ironic that on this Earth Day, most of us are inside or are at home and are not able to enjoy our amazing planet and our parks and our beaches the way we would love. It's also, of course, ironic that our sky and our air quality is probably the cleanest it has been since we've been celebrating Earth Day. But we want to just thank you for conserving water and still trying to practice the best that we can around this important commemoration that we have every single year. Again, I want to thank all of you for continuing to watch. We'll have more information on Friday. And now I'd like to turn this over to Dr. Davis, who's going to give an update as well.
Thank you, Mayor. Good afternoon. Over the weekend, we increased the city's capacity to test up to 500 people daily. Like the mayor mentioned, as we continue to ramp up testing across the city, we anticipate the number of positive cases to also rise. If you're waiting for your test results, please follow the quarantine and isolation health orders as they apply to you. And you can find those on our longbeach.gov/COVID-19 website under View Current Health Orders. If you test positive in one of our drive-through testing sites, you'll receive a phone call and a letter in the mail. At this point, you must isolate yourself in a separate room from others in your household who are not sick. You should notify any close contacts of your status and tell them to self-quarantine. If you test negative, you'll receive an email. If you don't have an email address, you'll receive a phone call. Protecting ourselves, our households, and our community comes down to each of us following the guidelines to self-isolate if we're sick and self-quarantine if we've been in contact with someone who is sick. Close contacts include individuals who live together, intimate partners, and anyone who's been within 6 feet of a contagious person for more than 10 minutes. Even people who haven't been tested but are exhibiting symptoms of COVID-19 should isolate themselves at home until they are cleared and notify any potential close contacts that they should self-quarantine. And I just want to review what being cleared from self-isolation for COVID entails. So number one, there should be 7 days since your symptoms started. Number two, there should be 3 days of no fever, and that's without using any fever-reducing medicines. And number three, your symptoms should have improved. So that's how you can clear yourself from self-isolation. And if you're a close contact and you're self-quarantining, you need to do that for 14 days. So I want to turn to the heat wave that we're expecting. The City of Long Beach expects a heat wave starting this weekend. We're recommending that all of our residents stay hydrated and wear light clothing. If you must leave your home to seek a cooler climate, Please continue to maintain 6 feet of separation from others. Carry a mask, a cloth facial covering, in case you find yourself in an area where you cannot physically distance yourself from others. If you can't maintain a physical distance of 6 feet, put on the cloth face covering until you can get to that distance. Finally, for all latest information and updates, please continue to check our website, www.longbeach.gov/COVID-19, and you can also follow us at Long Beach City on Facebook, Twitter, and Instagram. Thank you.
Thank you, Dr. Davis. We'll do questions from the press, and then after that, we will turn over for our Spanish recap from Alice Castellanos from the Health Department. So, Jake, questions?
Yeah, the first question is from Rachel from ABC7. Go ahead, Rachel.
Hey, so this question is for the mayor. Governor Newsom mentioned earlier that hospitals will now be rescheduling surgeries amid the coronavirus emergency. So can you tell us what would be the first step in starting to reopen the city? I know you had mentioned the Economic Recovery Advisory Group, but are there any plans in place, and what would come first?
So obviously, we were heartened to hear the governor making that announcement today. And so, of course, different all of our hospitals that are all part of different systems will be making, of course, we'll be planning kind of how they incorporate those recommendations, right? And so that's going to be hospital per hospital, system per system phase in. As it relates to the reopening of the economy itself, I can tell you that the amount of work and that went into how we kind of shut down the economy and kind of got people to stay home, and all of that coordination, that level of work, which was a huge citywide, statewide effort, is going into how we reopen in a way that is safe. So not only do we have the governor and the state and their principles, they are continuing to put out guidelines and are going to be setting some type of statewide baseline for all cities and counties to follow. Then, of course, we have our local economic recovery group who will be meeting. I believe they're going to be meeting within the next few days, and they're going to be putting together a set of recommendations on what the best way to open is when we reopen, and what are some of the innovative ideas out there for a small retailer, or how do we reopen some of these recreation activities that we want to see. How do we ensure that that restaurants in the future can operate in a way that is safe, that is creative? So they're going to come up with some really great ideas and present those to us, to our health officers, so that we take all of those in, and that the health department is able to put out a very clear and clean set of reopening orders when we are ready to do so. So the key question is, I am confident that we're going to have a great plan of how to reopen. And I have heard from restaurant owners, from folks that are park enthusiasts, from small business owners, from folks that own coffee shops. And these small business owners have the absolute best ideas on how they can make their shop, their business, their restaurant safe. Social distancing, facial coverings, separation, limiting occupancy, the way that they interact with customers. So the ideas are going to be there. The key question to me is the question around when. Mm-hmm. And the when question is very different than the how question. I think the how question is what we're working on furiously right now. The when question has to be guided completely by what's the right thing to do as it relates to public health. And that decision is going to be led by the people that know the most about public health: doctors, scientists, and our health professionals. And that's the advice that we're going to listen to statewide. It should be the advice we're listening to across the country, and it certainly is what we're going to be doing here locally. And so that when question is something we're discussing, and we're having that conversation every day. I'm having that conversation tonight with the group of mayors from the largest cities in the state, having that conversation in a few days with our friends, with Mayor Garcetti and the supervisors in LA County. So we are really struggling with this, but we want at the end of the day do the right thing around public health. And so those are the key things. And
Thank you, Mayor. This next question is geared towards Dr. Davis, and it really talks about expanded testing. Will that include individuals that are maybe asymptomatic, but people that are working in essential businesses? Do you have a plan for that, or is there an anticipated plan for that?
So right now, the plan is to expand asymptomatic testing within the long-term care facilities where they have outbreaks. There certainly is discussion about expanding asymptomatic testing. We want everybody who needs to have a test or feels like they should have a test to be able to have a test. So as the testing expands, we definitely will welcome everyone who feels that they need to have a test.
And I'll add, I think one of the great things about this expansion that the governor is talking about is we have to do a lot more testing. And so in Long Beach, when we launch these testing sites, we've been seeing them get busier every day, and we're seeing them get more and more capacity. And so as we add more testing, and we will be adding more testing even beyond the 500 capacity that we have right now daily, dependent on, of course, the folks that are coming in, how those appointments are being utilized. We're going to be looking at other essential type workers, first and foremost, our skilled nursing facilities, and other types of folks. When we're talking about, is it first responders? Obviously, we want to make sure that our medical personnel and other frontline folks can get a test when they need it. But those decisions have yet to fully be made, but they're being considered as the state expands their testing. And that actually was alluded to today by Governor Newsom. And so when we get our next testing site, drive-through site or testing site, which will be in addition to the 4 we have, and we will get another one, we're working with the state and the county on what that one will look like, and maybe it'll be a little different than the others, and we're having those discussions right now.
Mayor, this is another question from social media, and it relates to around the Economic Recovery Advisory Group that was established. And one of the individuals here on Facebook asked, are these salaried and paid positions, or are these individuals that have volunteered to step into this role?
All volunteer. They're all doing this because they love our city, like all of you do. And so these are folks that are all volunteering their time, and we're very, very grateful to them. So thank you.
Dr. Davis, we'll go ahead and wrap up with this question, but there's some individuals out here that are waiting for their test results, and they really haven't been notified, and some of them are going on a few days, and like to know how long should they wait, and where do they call if they're not getting the results in a timely manner?
We'll post where they can call, but we're actively working with the laboratory to get results for folks that have been tested. And we will be calling or emailing or sending letters as soon as we get these results.
And folks should know the reason there's delays is because we can perform the tests, and we do, but then they have to go to a lab to get those tests obviously completed. And as you can imagine, the backup at labs up and down the state and the country is enormous. And so some labs will have different backups than others. We've noticed that in the labs that we work with in Long Beach, we right now have some labs that are turning around a result in 48 hours. And so some of you that are getting tested in Long Beach are getting a 48-hour result. In other cases, you might be getting a test in Long Beach that might be going to a different lab, and that might be taking 6-7 days. And that's not just a Long Beach challenge. That's actually happening all across the country, where you have different locations where you can get a test and you can get results back in a day or 2 days. Other places you can get the same exact test or a similar test, and that might take you a week. And so we're trying to also move our resources. So if we know a lab is not performing as they should be, we're trying to get the other labs that are able to take more capacity to cover more of the tests. So that's something that's happening and moving very quickly. And we've already made quick adjustments, but we do know that there is a group of folks that got tested in Long Beach, and their results took longer than they should have, because of a issue with our lab partnership at the LA County site we had at Long Beach City College. So there were some challenges there, and those have been fixed, and they're continuing to we're continuing to adapt and change those.
Great. That seems to be a majority of the questions that we're getting. And obviously, this is something that we're continuing to work towards. You know, Mayor, today is Earth Day, and we want to really make sure that people are aware that they're getting some feedback here on Facebook that the streets are full of used gloves and masks. Could you just talk a little bit about what we're encouraging people to keep our city looking good?
Yeah, I just have no, I can't believe that I have seen, as many of you have, folks throw their masks or their gloves onto the floor in parking lots. It's completely irresponsible and no regard for public health or safety of other people. And again, on this Earth Day, we should never be littering. But to do so during a health crisis like this is really irresponsible. So please keep our city clean, keep our planet clean. Don't litter, period, no matter what it is. And let's take care of our community and the folks that live here.
Thank you very much, Mayor. One question about volunteering. Folks, if you want to volunteer, please make sure you follow us and visit us at www.longbeach.gov/COVID-19 and click on there, I want to help, and there'll be a volunteer link for you to engage. Mayor, that's it for the questions from Facebook and from our media. If you would, you can continue on, sir.
Thank you. And then I will turn this over to Alice to do a recap for us in Spanish. Thank you.
Muchas gracias, alcalde Robert García. Y muy buenas tardes a todos ustedes. También gracias por acompañarnos hoy, el 22 de abril, que también celebramos el aniversario del Día de la Tierra. Tenemos varias actualizaciones para compartir con usted hoy, pero vamos a empezar con unos datos de las pruebas de coronavirus en la ciudad. Desde hoy tenemos 489 residentes de Long Beach que han tenido resultados positivos del coronavirus. Hemos recibido varias preguntas sobre las pruebas y los sitios donde hacemos las pruebas y los números. En total, en completo de los 4 sitios donde hemos hecho pruebas del coronavirus, hay más de 4,700 pruebas hechas. En el Departamento de Salud han habido como 430. En el colegio de Long Beach City College sobre la PCH han habido 1,170. En Jordan High School casi 400 y en Cabrillo High School unos aproximadamente 180 pruebas del coronavirus. Y también, claro, con otros sitios privados y nuestras clínicas y laboratorios privados hemos visto a un total como otros 2,300 más. Queremos más decirles que esos números van a brincar. Vamos a abrir más sitios de pruebas en el futuro y también les tenemos más información sobre eso cuando lo tengamos. También queremos decirles que entre más pruebas hagamos en la ciudad, también los números de los positivos va a ir subiendo también. Lamentamos compartir que hemos perdido 3 residentes más de Long Beach por esta enfermedad. Nuestro total ahora es 27. Han visto muchas preguntas sobre los servicios de barredoras y los que limpian las calles de Long Beach. Queremos decirles que anoche la alcaldía de la ciudad de Long Beach extendió la suspensión temporal de las multas de barrido de las calles hasta el 18 de mayo. Para alinearse con la nueva orden de salud más segura en el hogar de la ciudad. Aunque los vehículos no serán multados, queremos aclarar que las operaciones regulares de barrido de calles regresará regularmente el 4 de mayo para eliminar los escombros y la basura de nuestras calles. Les pedimos a los residentes que por favor, si es posible, muevan sus vehículos siempre que sea posible para acomodar a nuestros barredores. Otra vez, el 4 de mayo, los empleados de nuestro Departamento de Obras Públicas colocarán tarjetas de recordatorio a cualquier vehículo que no se haya movido. Las tarjetas informarán a los residentes sobre la necesidad de mover sus automóviles, los recursos de estacionamiento disponibles en la ciudad y recordatorio que los servicios empezarán de nuevo desde el 18 de mayo. Para abordar los continuos impactos de estacionamiento causados por el coronavirus, hemos puesto a disposición más de 4,000 espacios de estacionamiento adicionales en varios lotes de la playa, centros de biblioteca y escuelas unificadas de Long Beach y en toda la ciudad. En este momento también pueden aplicar por un permiso para poder estacionarse en estos sitios. Unos datos sobre el grupo de asesor de recuperación económica. Sabemos que platicamos sobre esto el lunes también, pero nomás queremos decirle que este grupo va a hacer recomendaciones de varios departamentos de la ciudad en la transición estratégica de la ciudad y sus operaciones normales una vez que la pandemia del coronavirus permita cambios y en las órdenes de salud, primeramente. Las decisiones sobre cómo y cuándo abriremos la economía se alineará con la orden del gobernador de en casa, el gobernador y todas las órdenes de salud. La ciudad creará un foro en línea para alentar el compromiso cívico. Queremos saber de usted y esto ayudará a comprender mejor las necesidades de nuestra comunidad mientras nos preparemos para el futuro y para abrir nuevamente los negocios. Queremos hablarles poquito sobre los recursos de la biblioteca que son muy importantes para ahorita que los niños están en su casa. La nueva página web, su biblioteca en casa, hace que sea aún más fácil para familias de Long Beach continuar accediendo a muchos de los recursos de nuestra biblioteca. Aunque están las puertas cerradas de las bibliotecas, todavía pueden obtener una tarjeta de la biblioteca pública de Long Beach registrándose en línea. Hay cursos de desarrollo profesional al nivel universitario, ayuda con tareas en línea en vivo, aprendizaje de idiomas en línea y también audiolibros y libros electrónicos. Nuestro personal de la biblioteca ha estado haciendo un gran trabajo asegurando que los recursos de la biblioteca estén disponibles para todos. Puede activar su tarjeta de biblioteca y también puede llamar al 562-570-5700 desde las 10 de la mañana a 5 de la tarde, martes a sábado. Como le dijimos anteriormente, que hoy es el aniversario del Día de la Tierra y nomás queremos reflejar cómo podemos formar prácticas más sostenibles para proteger nuestro planeta. Le aliento a conservar el agua, la energía, reducir desperdicio, comprar productos ecológicos, cultivar algo y suscribirse a la facturación electrónica de los servicios públicos de Long Beach y otros servicios. También queremos recordarle que si puede compartir algunas fotos o consejos a cómo celebrar el Día de la Tierra también. Algunos de los datos que nos ha brindado nuestra doctora Davis del Departamento de Salud de Long Beach es el aislamiento y órdenes de cuarentena. A medida que continuamos aumentando las pruebas en toda la ciudad, anticipamos que el número de estos casos positivos va a subir. Si está esperando sus resultados de prueba, por favor siga las órdenes de salud, de cuarentena y aislamiento según sea su caso. Si fue evaluado en uno de nuestros sitios de Long Beach de autoservicio, los contactaremos por teléfono o por correo electrónico también respecto a sus resultados. La protección de nosotros mismos, nuestros hogares, nuestra comunidad, se reduce a cada uno de nosotros siguiendo las órdenes para aislarnos y si estamos enfermos, quedarnos en casa, a practicar la cuarentena y si hemos estado en contacto con alguien que está enfermo. Los contactos cercanos incluyen las personas que viven juntas, parejas íntimas, cualquier persona que haya estado a menos de 6 pies de una persona contagiosa durante un tiempo. También queremos decirles que incluso las personas que no se han hecho la prueba pero presentan síntomas del coronavirus, es recomendado que se autoaíslen y también que eliminen contacto con otras personas. La ciudad de Long Beach espera una ola de calor esta semana y entre el fin de semana, es muy importante mantenernos hidratados. Si debe salir de su casa para buscar un clima más fresco, continúe manteniendo una separación de 6 pies. Otras personas, si salen, por favor, protéjanse con una protección, una máscara de protección. Si es que no se puede mantener la distancia física, siempre es importante también usar la máscara y cargarla con usted a todos tiempos porque nunca sabe si sale de su carro en tránsito, en la marqueta o algún lugar donde hay más personas y no es posible a cada minuto protegerse con los 6 pies, aunque es una protección adicional tener esa cobertura puesta. Finalmente, para obtener más información y actualizaciones de los eventos recientes, continúe visitándonos en nuestra página de web de la ciudad de Long Beach. Es todo por hoy. Muchas gracias.
Y muchas gracias para que todos estén mirando. And again, thanks for watching the update. Have a good rest of the day, and we'll be back on Friday at 3 o'clock. Thank you.